asthma. So the symptoms are that the person has difficulty to breathe out and also maybe a fast pulse. Children can also have crowing in the night and also drawing in of the lower ribs by breathing in. And it can be also by mostly elderly people, there can be cardiac asthma. That is when not really asthma, it is when something at the heart. And another form is bronchitis asthma, or asthmatic bronchitis, that is after recurrent bronchitis infections. Sometimes young babies, 1 year old or months old, have a wheezing sound when breathing, but that can clear up when the bronchs just grow larger. And now, prevention, there is not really one known what causes it. It is associated a bit with eczema, inflammation of the skin. Now, the pure reasons are that it is obstruction through phlegm or swollen through inflammation or bronchospasm with the muscles around the air tubes tightening. How to prevent it? It can be allergic against feathers, house dust mites, pets, or through anxiety getting stronger. And when to remove the allergic cause, if it is found, it can be because of different allergic things at the same time. So to just remove one is maybe not enough to find it. To stay out of smoky and dusty environments, not to smoke, and there are medications, so the person should be helped to live as normal as life as possible, and help from parents, from friends or doctors, who also then should know how medication can help to prevent or cut short or to have less attacks of it. And that is according to Keith Hodgkin's Family Medical Advisor book on page 80, but this is no medical advice. If you click this video away, then please tell me what the reason for it was so that I can improve. Otherwise, hi and welcome. I am trying to learn medicine, today asthma, and after we have done that, we're gonna do stretching. And if you participate in the stretching, then it's that at your own risk. And we're gonna read now this text. We try to understand it just. So this is no medical advice. I'm just reading it and trying to understand it. It's already the 4th time that we're reading it. Now we're trying to getting the informations together and we try to say them after that out of memory. Asthma. Asthma is a word which often conjures up a frightening picture of patients fighting desperately to get their breath. So it is understandable that many parents may be apprehensive when they hear their child wheeze. But wheezy breathing is common in young children and usually does not indicate that true asthma is present or will develop later. So there can be, we understood the text, there can be asthma, there can be a wheezy sound by young babies, but it doesn't mean that it develops then. Asthma occurs when the small bronchial passages in the lungs become swollen with inflammation, partially obstructed by phlegm, or narrowed when the muscles surrounding the air tubes become tight, bronchospasm. Obstructed through phlegm, bronchospasm, the muscles around the air tubes tightening up, and inflammation. Swollen with inflammation. Some babies go through their first year of life with noisy, sometimes wheezy breathing, which is normal for them. As they grow, the small air tubes enlarge and the wheezy breathing disappears. Asthma tends to run in families, and in one form it is associated with an inflammation of the skin, eczema. Let's skip one forward to the causes. Prevention. Asthma cannot be prevented, but the likelihood of an attack can be reduced by taking certain precautions. Not to smoke, to keep out of dusty, smoky surroundings, and seek always prompt attention for coughs and colds. And if it's allergic, then remove the allergic thing if it is found what it is. And the book is from the 70s, so it can be that there's more known, maybe about the causes. So it tends to run in families, and it's also associated with eczema, with the inflammation of the skin, eczema. Asthma may appear for the first time in childhood or in adolescence, often as an extension of hay fever. It can also appear out of the blue later in life, the so-called late-onset asthma, which can be much more disabling than other forms and is often associated with the recurrent chest infections. True asthma is a respiratory problem, but the symptoms may be confused with cardiac asthma, which occurs at night in older patients with serious heart disease. Asthmatic bronchitis, sometimes called chronic obstructive airway disease, may develop after recurrent attacks of bronchitis. So there is cardiac asthma and asthmatic bronchitis. So the first thing we try to say it is that there are also people with cardiac asthma, which older patients, which mostly patients who are older with heart diseases have cardiac asthma, and asthmatic bronchitis that can develop after recurrent attacks of bronchitis. Asthmatic bronchitis, cardiac asthma, asthmatic bronchitis. The reasons were an obstruction for Flecken, inflammation, swollen with inflammation, and bronchospasm. The muscles are tightening around the air tubes. Sometimes babies have a wheezy sound, but it can also just go away when the air tubes or bronchus enlarge and the child grows. And something else big. It tends to run in families, but it is a bit associated with the inflammation of a skin disease, eczema. And to prevent it, if it is allergic, remove the allergic cause if it is found, not to smoke, not to be in dusty or smoky environments, and to seek always prompt medical attention or help by coughs and colds. But it is generally not known, or cannot be prevented, not known. Symptoms: coughing, wheezing, difficulty in breathing, by breathing out with wheezing, and main difficulty breathing. So coughing, and then wheezing and breathing problems by breathing out. Coughing, wheezing, breathing problems by breathing out, and persistent coughing at night can be symptoms, and by chronic, and it can be also the symptoms. No symptom named here. Just cardiac asthma can also be a problem at the heart, and asthmatic bronchitis, recurrent bronchitis infections. So coughing in children at night, fast pulse, and drawing in of the lower ribs on breathing in, and drawing in on the ribs. Coughing at night by babies, by children, drawing in of the lower ribs, coughing and breathing out, wheezing and breathing difficulties. Causes: respiratory infection may cause inflammation of the tubes, allergy to certain substances ranging from the house dust meat to animal fur or feathers and pollen of foods. It can be caused allergically through feathers, furs, house dust meats. What was it? House dust meats. It seems to be one name. House dust meats. The house dust meats. Nocturnal attacks in children are often associated with house dust meats. Down pillows or pets sleeping in a child's bedroom. It can be because of a pet or anxiety. So we're having respiratory infections can cause inflammation, which is one of the three. One was obstructive phlegm, inflammation, swollen for infection, and the third one was bronchospasm. It can be pets, house dust meats, feather, pollen, food, anxiety. And the next thing is then the child must be encouraged to lead as full and normal a life as possible, yet at the same time be helped and supported to do this by parents and doctors who understand how modern drugs can be used to prevent and control attacks. So the person should get help and support to live as normal as life as possible through the person's parents, friends, or the doctors who also know how some medication can help to prevent and control the attacks. Prescribe medicines that can cut short, prevent, or modify sudden attacks to control more prolonged bouts. So medication, respiratory infections controlling with antibiotics also. And finding out what the allergic thing is, it can be two at a time, so it can be hard to find out if just one is at a time removed. Okay, we are through it all. I'm going to start the second camera and try to set it out. Let's just start and start again if something's missing. Asthma. So the symptoms are that the person has difficulty to breathe out and also maybe a fast pulse. Children can also have cawing in the night and also drawing in of the lower ribs by breathing in. And it can be also by mostly elderly people, there can be cardiac asthma. That is when not really asthma, it is when something at the heart. And another form is bronchitis asthma, or asthmatic bronchitis, that is after recurrent bronchitis infections. Sometimes young babies, 1 year old or months old, have a wheezing sound when breathing, but that can clear up when the bronchs just grow larger. And now, prevention, there is now really one known what causes it. It is associated a bit with eczema, inflammation of the skin. Now, the pure reasons are that it is obstruction through phlegm, or swollen through inflammation, or bronchospasm with the muscles around the air tubes tightening. How to prevent it? It can be allergic against feathers, house dust mites, pets, or through anxiety getting stronger. And when to remove the allergic cause, if it is found, it can be because of different allergic things at the same time. So to just remove one is maybe not enough to find it. To stay out of smoky and dusty environments, not to smoke, and there are medications, so the person should be helped to live as normal as life as possible, and help from parents, from friends or doctors, who also then should know how medication can help to prevent or cut short or to have less attacks of it. And that is according to Keith Hodgkin's Family Medical Advisor book on the page 80, but this is now medical advice. Now, did we forgot something too much? I think I said it actually. I can't find a thing which I did not say. I think I forgot a lot, but I think I said it all. So I'm going to stop the camera. We have at least the most. So that was the medical part. If you were here for medicine, you can go directly to the next part of medicine. This was no medical advice in order, I just read and tried to understand it. If you were here for medicine, you can go directly to the next part of medicine. If you stay here and participate in the stretching, then it's at your own risk. The feet are standing together, and we're doing the routine 3 exercise. One toe to the outside, other toe. The heels and the other heels. The toes and the toes, heels and heels, and ever so on, as far as possible. And then again, in, one by one. Stay down, go to the knees. And up. A bit apart with the legs, breathe in, lift the arms up. And breathe out and go to the side. Again, in into the middle, and out over to the other side. Again in, and out and down. Breathe again in. And the next exercise, no one sees the accorder exercise. One hand slides down the leg, the other shoulder stays down. Breathe again in, and out and one arm. Breathe in and out the rib cage, and out and back. Breathe again in, and out and one hand slides down the leg. Breathe again in, and out one arm. Breathe in and out the rib cage, and out and back. If the feet standing together, and we're doing the aeronautic aerobatic aeroplane exercise. Breathe in with the arms up, and breathe out one arm down. Breathe in and reach, and again out. In and reach high, out the other hand down. Breathe in and reach, Hold one hand up and both down. Just shoulder circles, legs standing good and stable, and back, up, and front, and down. And backwards. And now breathe in and lift the shoulders up. And out, let them fall down. Again in. And out. Breathe in, lift the arms up. And we're doing the apple plucker. Reach high. Pretend to take an apple hanging high with an apple branch. Pretend to turn it a bit around and then to flip it out. And now the shifter exercise. Legs wide apart, arms up to a T. Breathe in. And out and shift over. Again in. And out. Again in. And out, we're leaning onto the knees. The buffalo fighting its hangover exercise. Breathe again in. And out one arm in front. And back. Out the other one in front. And back. Breathe in. And out in the hanging down the Niagara Falls. Breathe again in. And out over to one leg. Again in. Out over to the other leg. Back into the middle. Close the feet in, we're doing the salto angelo. Breathe again in. And out. Breathe in. And out we go slowly up, around back, and the backwards shoulder roll. And we're ending with a trunk igniter. Legs wide to the side, breathing down. And breathing out. Draw the shoulder blades together. In and up. Out. One more round. Out. In and up. Up and down. Breathe in, close the legs. And breathe again out. That was the stretching. Thank you very much, and until next time.